This video is for those doctors, medical centers, hospitals who want to start up a hair transplant division in this setup or who want to introduce hair restoration practice into their regular practice. I am Dr. Vivek, co-founder ISHR, Indian Society of Hair Restoration, world's leading hair transplant training academy. Learn from the experts and be the experts. Get ISHR certified. Our faculty includes plastic surgeons, dermatologists, facial surgeons, and hair research experts. We are headquartered at Mumbai, India, and have aligned centers across India, Middle East, and few countries across the globe. We offer both online video workshops and practical workshops under expert supervision. Hair transplant is all about hand-eye coordination under magnification. Hence, you need good number of practical exposures. Hence, we offer level 1 certificate workshop, level 2 master's workshop, and level 3 advanced fellowship workshop. We teach you the new keep implant techniques, that is the no root touch technique. We teach you the DPI technique, the pen implant technique, where no slit method is required. Of course, we'll teach you the regular double forceps technique. Most important, the magnification loop use, which is critical in a hair transplant because a hair follicle has a very high metabolic rate. It should be treated like a diamond. So use of a magnification loops makes great hair transplant results. We also teach you the new biotech FUE. That means when you puncture the grafts at the back, there may be a chances of post-FUE hair transplant microdots or honeycomb appearance if you shave it off. To reduce it, we have a biotech FUE technique so that the collagen rearrangement is normal and the scarring is reduced to minimum. Now comes the real thing of 2022, that is the Super Instant FUE. As you know, in the traditional hair transplant methods, the hair graft used to be kept out for hours and then implanted. For example, a finger is cut, you have to immediately fix it or it may die. Similarly, in 3 to 15 minutes, the hair graft may die. So we have to simultaneously extract and implant the grafts so that the outside the scalp time of the graft is minimized to not more than 15 to 30 minutes. Now this is called Super Instant FUE. This has dramatically changed the results of hair restoration, especially in the last 2-3 years. Speciality for fellowship hair transplant program is we just don't teach you the basics in hair transplant. We teach you the newest, the latest, and what the best doctors in the world follow for a great hair transplant results. Although hair transplant is a safe procedure, it is done under local anesthesia, but complications may arise. So you need to be thoroughly trained on medical emergencies, possible surgical complications. Your OT should be fully equipped with defibrillator, emergency medication, oxygen requirement, etc. You should also have an anesthetist in your operation theater. So safety in hair transplant is an important part of the training so that first of all you select the right cases, you do proper investigations, and then you go for a hair transplant, keeping in mind what can go wrong and are you prepared for the same. Hair transplant is not just the science, it is also the art. An aesthetic and artistic doctor is going to deliver very good results and natural hair transplant results to your patients. For the same, great hairline design, zigzag pattern, use of soft hair from nape of the neck is critical. Even if somebody is a poor donor, has less hair, still you need to fill the full scalp. So the illusion of density how one creates, the distribution of interlocking of the grafts, the lateral slits are so important. And also is the 20-25 degree angles at the frontal scalp, 30-35 degree angles at the mid scalp, and so on, and 10-15 degree angles at the frontotemporal angle and 5 degree angles at the temples, different angles at the beard, mustache, eyebrows. These are all very critical for very artistic results. The curls should be towards the scalp, the depth should be perfect so that the graft reaches the subcutaneous tissue and most of the graft should be growing. You will also be taught about the sapphire blades incision making or the lateral slits incision making. It makes the hair density more, the trauma is less. You should also know the natural flow of the hair grafts in various parts of the human scalp. It could be different on the crowns, it will be different around frontotemporal angle, in the temples, and so on. It may be different both in the men and women. So understanding the anatomy of the scalp, physiology of the scalp, nerve supply of the scalp, blood supply of the scalp is also critical, especially when you give the local anesthesia. And local anesthesia has to be given and chosen a very safer option. You have heard about PRP. We are going to teach you advanced version of PRP called PRF. Both the liquid PRF as well as the extended release PRF. What is the difference? PRP stays maybe 6 to 8 hours on the scalp and goes out of the urine. but the PRF may stay 15 to 20 days. So imagine all the growth factors, all the platelet-rich plasma would stay there and nourish much longer. So this will make you this will make your healing better as well as post-transplant results better. Of course, we're going to cover the basics like hair transplant consultation, how to choose the right hair transplant patients, whom to avoid, hairline mapping, donor mapping, understanding the safe donor area, understanding the angle directions, curls as we discussed, pre-operative, post-operative care. Of course, how many grafts are required in the recipient, how many grafts are available in the donor area, how to create the right design and look for the patients when you're implanting the grafts. Of course, the dermopath conditions like lichen planus, like alopecia areata and other conditions whom you should avoid and examine properly to make sure that the hair transplant doesn't fail. You will be exposed to different types of hair transplant FUE punches and different types of device. The fully rotational device, the manual device, the oscillation device with different torques. Punches could be the trumpet punches, the latest one, the serrated punches, the dull punches, the sharp punches, and so on. The exclusive thing, one of the exclusive topic which we are going to cover with you in the fellowship program is the physics of FUE, the dynamics of FUE, the challenges of FUE extraction, the difficult cases, the repeat cases, how to repair the wrong hair transplants. So that will be covered at the end once you have covered the basic levels. And of course, once you've finished the training program, you've got your fellowship for the masters, then we are going to help you how to establish yourself in a competitive environment and deliver best results and let the patients know that you are the best. So it is a 360-degree help to you where you can access our faculty for the whole year. How do you brand your clinic, how you position your clinic, how you communicate your clinic, the role of YouTube, Google, Facebook, Insta, references, patient care and follow-ups. So that is very critical. Even if you're the best, if you don't project yourself, if you don't communicate yourself, people may not know you. Do not just finish the course and don't do it, but start your hair transplant center. So we will discuss together with city are you in, what is the competition over there, what sort of patients will be available there, and then we'll develop a business model for you. We'll let you know how to brand yourself, position yourself, communicate yourself. If you have staff requirement, we'll help you with the hair transplant technicians, business development team, and so on. So you have to be in touch with us throughout the year. When you do your initial cases, you have to be on a video call with us so that we remind you of the protocol, the safety protocol, so that you deliver the best results. So all the best, doctors. If you want to know more details, please WhatsApp in the below numbers. One of our doctors or the course coordinator will attend to you and give you details about the duration of the courses, fees of the courses for both Indian doctors and overseas doctors, and the dates of the various courses in India and abroad. So do write your comments if you want to know more about these courses or anything else you want to know from us, and also send on your details so that my doctors can follow up with you and provide you the details you require. Wishing you all the best for your new journey into the practice of hair restoration.